doctors by experience, 6 months experience, or our other doctors, 75 rupee or 500 rupee. This bracket is actually absolutely useless.
Yeah, this should not be done, right? If I'm coming for a hair transplant, there should be transparency, right?
Coming down to the break even of doctors by experience, 6 months experience, or our other doctors, 75 rupee or 500 rupee. This bracket is actually absolutely useless.
Yeah, this should not be done, right? If I'm coming for a hair transplant, there should be transparency, right? So it should not be counted on the money,
especially,
and experience also. Yeah.
Yes, and especially the major thing is, okay, fine. If you get the surgery done from a doctor,
and even for the consultation also, the clinic I went, if you want a consultation from a senior clinic, you have to pay 10,000 rupees. So something like that are also happening.
Yeah, so I think that is some or the other way to discourage the exchange of knowledge between patient and the doctor. And I think this will take an opportunity away to take an informed decision on your part.
Yes.
So as long as hair restoration is concerned, it is not something which you do once. You might need, it is a journey. You might need repeat transplants. You might need increasing doses of medicines. Medicines have their consequences in your body, and we have to take care of yourself in totality, not just head of hair. So rest of the body, we might not care, but we need to. So as far as medicines are concerned, did the clinic discuss with you the role of microdosing? Or this is the standard set pattern?
No, so they have decided a pattern only, like you have to take 1 mg.
For every patient?
Every patient, yeah.
So that means if you are 42, let's take my scenario. I am 48. I did my transplant 4 years back. I was having a very slowly progressive thinning, maybe in the forehead. Since long time I had a broad forehead. So these hair were good. So am I a good candidate for medicine? No.
Yeah.
I should not take the medicine. I won't allow the medicine in my ecosystem because my hair loss is stable. So whatever I have created in my hairline, including the merging with existing hair, giving the density in the lowered hairline, and creating a softer look of hairline, all achieved through the skill of surgeon. So what do you think? You will pay for the skill of surgeon, or you will pay for the results which medicine is getting you?
Yeah, if I have to pay for the medicine, why I will do a hair transplant, right?
Obviously.
So there is also a journey, right? As you said, hair transplant is a journey. I have to spend my time. I have to be like extra precautious after the transplant. So a lot of things are happening also after the transplant. So why I would waste my money and time also if the medicine will work?
Exactly. And see, if you start with full doses of medicine, the US FDA approved doses, what will you do when your body develops tolerance to that dose? What will you do?
Yeah, so that left us with no options.
No option.
Yeah.
And what will doctor do? Extra. What extra will doctor do for that? Nothing.
Yes.
So doctor can't do anything. So if you titrate the doses, if the goal of medicine is to sustain your existing hair, not aiming at free kabal and free ka credit, then the dosage of medicine should be reduced. We do transplants in patients where we give just say 1 mg or 1.5 mg per week, not per day.
Yeah.
And we are able to sustain the results for long. Just now I was consulting a patient, 2 years repair case, So, and your friend, he's not taking the medicine at all.
Yeah, not taking the medicine.
So that means medicine is not mandatory for the results. In every patient we don't need to give the medicine, but that doesn't mean that in every patient we can do the transplant without medicine also. So the basic concept is to customize the treatment according to the need of the patient. Every individual is different. For what a 40 years old needs, will be different from what a 24, 23 years old guy needs. So the role of medicine, the dosage of medicine, the hairline, the consumption of grafts which you are going to do, everything has to be monitored.